Hello, hello. Hey, everybody on YouTube and on Zoom. Welcome to Correcticise for Life Lesson 14. It's hard to believe that we are, down to the count here as far as lessons, mini trainings go. So it's kind of good. I'm a little bit, I wouldn't say I'm short on material, but, I really went through, and today I wanted to kind of focus on, what I haven't spoken about. What maybe I haven't made clear, and what messages I want to really go ahead and speak out about. So today is lesson 14. And again, I'm going to go ahead and share my screen. And I'm not seeing my PowerPoint on there. So let me get that on there. Yeah, welcome guys, lesson 14. We're down to the final count here. All right, let's see if we can do this again. Trying to get my PowerPoint up. There it is. So today I called this lesson Mindset, Medicine, and Miscellaneous. So again, I think I'm going to have to show it this way today because my PowerPoint is in a little funky position here. Yeah, there we go. Let me do that. All right, so I am Dale Walker, if you don't know that by now, but maybe you're joining me for the first time. I am a licensed physical therapist with degrees in fitness, cardiac rehab, and exercise science. I have a website called fixyouonline.com. I actually have several websites, but this is what I'm using right now. Fix You Online TV is the YouTube channel, which many of you are joining me on, and welcome. And then the Facebook group is Fix You Online. So today, I said I was running a little bit low on material, but not really, because I'm sure I could think of more things to present to you, but I wanted to really hone in on the things that I think are important and maybe something that I haven't covered. And so I'm going to start talking about mindset. And this is an area of medicine or healing or, healing and medicine that is not really spoken about so much. It's not really, it's starting to get more traction, but it is actually really kind of based in science. And so I'm going to tell you why. And this is one of my favorite aspects of medicine, right, that I know of, and that is placebo. And so what the placebo is that it's basically getting a result that you shouldn't, that has no explanation, because you're given a substance or something that is known not to do anything to help your symptoms. However, you do get better. And I have a kind of a personal funny story. I switched doctors at like about 36 weeks into my pregnancy. And I had, I used to get pretty severe sinus infections to the point where I've experienced vertigo, and it is not fun. So anyway, I had been battling this sinus infection. I know what it feels like, and I know my body really well for a long time. And I went to this new doctor, and I asked him for antibiotics. And in fact, I told him which antibiotic works for me, et cetera. And I was shocked, but actually pleasantly surprised that he did not want to give me the antibiotic. And I said to him, I said, well, and I applauded him. I said, you don't understand. I never ask for medication unless I need it. And that still stands to this day. So he said, do you have a fever? And I said, no. He said, well, you would have a fever if you had a sinus infection. And I wound up saying to him, I'm like, well, what about the placebo effect? And he actually wrote me a script when he did. And wouldn't you know that my quote unquote, my symptoms of sinus infection did in fact go away. Now, since then, I've actually discovered something that works really, really well recently, because again, for some reason, I'm prone to these things, is a ginger steam bath, which means that you put ginger in water and you boil it, and then you put a towel over your head and you put it to the correct temperature that you're not burning your respiratory tract or your nostrils, but warm enough to create steam. And I tell you, I had one in March and those symptoms went away almost immediately. So there's my new treatment for sinus infection. So I don't need to do this anymore. But there's there's some other factors aside from placebo effect. So again, according to a study published in the New England Journal of Medicine, doctors have long known that 35% of all patients given a placebo will get better. And they assumed that it was because the patients believed the dummy medication would help them. Now, what's interesting too is that I spoke to a naturopath who told me that there's a test when they do some DNA testing on their clients that they can actually test for how well the placebo will work on certain people. So that's why I put that there's a possible DNA link here. And so I think that it is really important to talk about mindset because in 35% of the population, it seems to be a very big factor and perhaps more. So here's more evidence about placebo. There's something called convergence disorder. And convergence disorder is when an individual will present with symptoms of a disease process or a disability and has no medical or testing evidence of such a disorder. And I consider myself lucky because I experienced one of these patients when I was in training. And I was a student and she was an individual who presented with paraplegia. So she presented with paralysis from the waist down. However, there was no evidence on any diagnostic tests of any reason, any medical reason to explain her symptoms. So her diagnosis was convergence disorder, and that's where I learned about it. And when I was, when I asked my supervisor, well, how to treat this person, they say, treat her as if she has paraplegia. So that is what I did. And it is a known psychiatric disorder. You can look it up and it will substantiate what I'm talking about. Then there's also something called medical students disease, and it's also known as second year syndrome or intern syndrome. And it's a condition frequently reported in medical students who perceive themselves to be experiencing symptoms of disease that they are studying. So when it is in front of your face and in your consciousness, in your mind, then oftentimes people will relate to that behavior or, or situation because they are aware of it. So I just think that's really very, very interesting, particularly with what's going on in our world right now with a disease process that's getting a lot of attention. And I don't have an opinion per se about it, but it would not surprise me if there is a placebo effect going on in certain situations. And because again, it is a known factor in health and healing. And I think the most powerful evidence of this for me was a book that I read by Oliver Sacks. And for those of you who don't know who Oliver Sacks was, he passed a few years ago. He was a fascinating neurologist who wrote many, many books, over like 10 or 15 books. And he bridged the path between clinical doctor, scientist, and human being. And I think that's what made him so endearing. He was a very endearing man. And he had specials on PBS. And really, I very much enjoyed his book, from a kind of a medical geek standpoint. But I read his autobiography a few years ago, and I was so struck by this particular chapter that I copied it, and it's on my computer, so I'm going to share it. But I'll tell you a little bit more about the story because some of you might be familiar with what I'm going to talk about. Oliver Sacks was also the doctor that was portrayed by Robin Williams in the movie Awakenings. And so some of his books that were based upon true stories, and this Awakenings was based on his experience at a hospital in the Bronx, working with patients who had a meningitis that turned into a like catatonic stupor, where they were not functioning. They were almost in a phase, in a haze. And he wound up giving them a drug that's now used for Parkinson's called L-Dopa. And he was able to bring them out of this state for a period of time. There was one patient in particular that he chronicled. His name was Lenny, and he was played by Robert De Niro. And so in the paragraph I'm going to read to you, it's from Dr. Sacks's book, talking about his experience being on the set with Robin Williams and Robert De Niro during the filming of Awakenings. And for me, this is probably one of the strongest evidences of mindset that I can possibly think of. And again, when I read it, it was quite, I almost want to say career changing or life changing, or, it was just a big epiphany for me. So I'm going to go ahead and try to find that on my screen. And if not, I'll get it. Yes, here it is. Okay. So I'll read this out loud and you might be able to see it as well. It says, can an actor with a normally functioning nervous system and physiology truly, quotes, become someone with a profound abnormal nervous system, experience, and behavior? On one occasion, Bob, Robert De Niro, and Robin Williams, were depicting a scene in which the doctor is testing the patient's postural reflexes, in parentheses, which can be absent or severely impaired in Parkinsonism. So again, these patients presented with a severe form of Parkinsonism. I took Robin's place for a moment to show how one tests these. So as a doctor, he was demonstrating this. One stands behind the patient and very lightly pulls him backward. A normal person would accommodate to this, but in a Parkinsonian and post-encephalitic, which was the disease that they had, might fall backwards like a 9-pin. As I demonstrated this on Bob, he fell backwards onto me, completely inert and passive, with no hint of any reflexive reaction. Startled, I pushed him gently forward to the upright position, but now he started to topple forward. I couldn't balance him. I had a sense of bewilderment mixed with panic. For a moment, he had actually lost all his postural reflexes. Could acting like this, I wondered, actually alter the nervous system? So the next day, I was talking with him in his dressing room before the day's shooting. And as we talked, I noticed that his right foot was turned in with precisely the dystonic curvature. It was held in when he portrayed Leonard in the movie on the set. I commented on this and Bob seemed rather startled. I didn't realize this, he said. I guess it's unconscious. He sometimes stayed in character for hours or days. He would make comments at dinner which belonged to Leonard, not himself, as if residues of the Leonard mind and character were still adhering to him. So what I wanted to say here is just that, I think I remember reading is that Dr. Sacks had even said, perhaps later on, and I don't want to spend too much time on it, that he wondered if an MRI was done on Robert De Niro's brain at the exact time that he was shooting the movie, if he in fact would show physical changes in the brain. And this makes a good amount of sense when you think about actors who've gone into character and it's literally kind of changed them. And so I have a friend who happens to be an actress, and I wound up writing to her and I sent her this and I said, well, how do you guys do that? And they just embody the character and their mind takes over so that they can assume postures and attitudes and speech. And the good ones are really good at this, like Robert De Niro. So my question is that if someone could create disease, then can't they create healing? And that was my epiphany from reading that story in Dr. Sacks's book. And like I said, it was fairly life-changing to me. So I mention it. The next one is, what are negative mindset characteristics? So, thoughts and beliefs have power. And they're both something that we can control. We just don't obviously know how. Now, there's also verbal communication. So it drives me a little insane when somebody says something like, I have arthritis, because they're owning this characteristic rather than saying, I have been given a diagnosis of osteoarthritis, because osteoarthritis means nothing unless it is impeding upon somebody's quality of life to the point that a surgical intervention would be necessary. So I had a teacher in one of my classes who said that sometimes giving a patient an MRI is like giving them a license to hurt, because 80% of people who have no symptoms of a herniated disc will show a herniated disc on an MRI. Most people post-mortem that were dissected, they found cartilage tears in their knees. So the majority of us are walking around with these things, and they're not, they don't matter until it's collaborated with symptoms that give people an explanation for something. And so again, it really doesn't mean anything. It's a way of coding for insurance, and that just happens to be the way that we do it. But to take on the characteristic of a thing and saying I have, or I am diabetic, or is very, very, it's very powerful. And I encourage people to be careful with their communication. And then obviously also nonverbal communication. So things like your posture. So there's a famous physical therapist who said, posture reflects your attitude toward life. That's where we get back into alignment and emotion. So I think your nonverbal communication is really important. And again, why I am such a proponent of, one of the reasons of alignment. Also, breathing, right? We're in control of our breathing. And a lot of times we become, breathing is so fascinating because it's the only activity that is both unconscious and conscious, right? That we can control. We can actually control our heart rate. Biofeedback would be another thing that would substantiate mindset. So again, there's another example. And then talking about the vagus nerve. So the vagus nerve is getting a lot of attention lately, a lot of attention within the medical community and the holistic community. And it is a pathway for the unconscious nervous system called the autonomic nervous system. And that controls things like digestion, and it is part of the fight or flight reflex, and it is the calming of the nervous system. So there's been a lot of study and attention being placed to the vagus nerve, and I confess that I know very little about it. But individuals are finding a lot of relief to things like irritable bowel, to anxiety, to a number of different situations or diagnoses that are associated with the vagus nerve. And then we go to positive mindset characteristics. Again, verbal communication, nonverbal communication, control of breath, thoughts, and focus. So this is meditation, guys. And understanding the power of your brain. There are many individuals who can actually turn off symptoms with their brain, the ones who have really powerful minds. And there's an individual who's in the reference right here who is one of them. And his name is Joe Dispenza. And Joe Dispenza has written a number of books, called one of which called The Placebo Effect. And if you have not read it when you're interested in this, I highly recommend that. And then Norman Doidge's books about the brain. So he put, let's see, The Brain's Way of Healing, or How the Brain Heals Itself. He has, I gave an example of one of them because he talks about people with Meniere's and other types of alternative healing. In fact, in one of his books, there was an individual who claimed to be able to cure themselves of Parkinson's. So another personal story that I'll get into is just that several years ago, gosh, I'm trying to think of exactly when it happened. It was probably 2000, okay, my daughter was 4. So 2014, 2013 or 2014. I went to an outdoor movie in Rhode Island, and the next day, my fingers and my toes were swollen. And so I immediately thought I had Lyme's disease. Called my doctor and I said, listen, I think I got the by tick, because I know early intervention is really important. So when I called her, I said, I think I have Lyme's. And she said, well, symptoms of Lyme's don't show for, I think it was 6 weeks or 8 weeks. Okay. So I just kind of, poo-pooed it and, went about my daily life. And sure enough, almost to the day, whatever the week away it was. And again, I didn't even think of it. And truthfully, when I wound up getting what I thought was the flu, because I had about 104 temperature and I was extremely achy. So here I am in September in Florida thinking I have the flu. And then I forget what it was, but something triggered me. It's like, wait a second, let me go back to my calendar. And sure enough, it was that time frame. So again, I called her and my doctor is in New York. So I happened to be going to New York in a few weeks and I scheduled an appointment and I wound up getting blood tests. And I think there were 3 Lyme's blood tests. I think 2 of mine were positive, but 1 wasn't. So I was not, from a medical standpoint, given the diagnosis of Lyme's disease. However, I did, I think on one other occasion, experience that body pain. And I think it's because I've been a competitive athlete since I was 12. I guess I still consider myself that, but I was a competitive athlete from 12 to 20. And I know what I can tolerate and live with muscle soreness. But I have to say it was pretty severe muscle soreness. I think I can understand why somebody who was not an athlete and would have that muscle soreness would have a really tough time with it. My body can just acclimate to it. So since I was not given the medical diagnosis of Lyme's disease, I went to holistic practitioners and found somebody who was an expert in Lyme's, in fact, cleared her own Lyme's, and contacted her, went on a protocol, and I have not had a problem since. Now, apparently Lyme's does not go away, but I have not had a symptom or an exacerbation like the first time. So I'm going to assume that it is controlled at this point in time. But I just wanted to share that, and it could very well be because I didn't give it much attention or much of my mindset. So that is kind of important to take a look at. And so I think what I want to finish up on is that, be aware of a lot of, the different factors that are involved in health, healing, and fitness. And I guess under fitness, I would put mindset would be another aspect of fitness, because the mind can cause disease like conversions disorder. And it can also cure diseases like with placebo. So keeping that in your consciousness as well. When I had chronic pain from the undiagnosed infection in my tooth from the dental procedure that I had, I literally had to ask myself, am I making this up? Am I creating this? And, I really had to be very honest and think of the reasons why I would create it, and none of them applied. So, again, be very mindful. And when people do have chronic pain, it does mess with their minds. So, any patient that I work with who's been experiencing something for a long period of time, I feel that it's my due diligence to address it and encourage things like meditation. I've even given meditations to people when I've worked with them, when I believe it is a component to their pain. And again, it does not mean you're crazy. It does not. It just means that your mind is quite powerful, and it can be powerful for the positive, or it can be powerful for the negative. And I think that that's important to realize. So with that, I will, unless there's any questions, which I don't see, but if there are any questions, I'll go ahead and check on YouTube. But, look into those books. And if this is something of interest to you, definitely do your research on it, because I personally find it fascinating. And so I would encourage everyone to keep it in mind when they are experiencing something in their lives. So with that, I am going to be starting my total body renovation for Correcticise for your total body renovation on Correcticise for life. And you can access a 14-day free trial. You can go to fixyouonline.com and you will see the ability to get a 14-day free trial. Today, we are going to be working on the toes. We are going to work on all 14 joints. I reviewed and previewed this yesterday. There's a preview on YouTube. There's information on the YouTube channel, Fix You Online TV. And you guys can always reach out to me, either Facebook, you can PM me, DL Walker, or Fix You Online, as well as if you want to reach me personally, it's fixyouonline@gmail. So I hope you guys enjoyed the training as much as I did. I'm a little exhausted and kind of going to be a little bit glad for tomorrow when I'm not going to be doing a live presentation at 5, because it has been a commitment, but one that I have enjoyed, and I hope you gained from my knowledge and wisdom, and continue to do so, maybe with Correcticise or one of the other programs that I have. So thank you so much for watching, and have a good night. Bye.